Welcome to Nursing Prep. Push yourself in nursing preparation with smart way. Practice this quiz on www.thestudyblog.com. Fundamentals of nursing. The nurse in charge must monitor a patient receiving chloramphenicol for adverse drug reaction. What is the most toxic reaction to chloramphenicol? Option A. Lethal arrhythmias. Option B. Malignant hypertension. Option C. Status epilepticus. Option D. Bone marrow suppression. Right answer is Option D. Bone marrow suppression. The most toxic reaction to chloramphenicol is bone marrow suppression. Chloramphenicol is not known to cause lethal arrhythmias, malignant hypertension, or status epilepticus. A female patient is diagnosed with deep vein thrombosis. Which nursing diagnosis should receive highest priority at this time? Option A. Impaired gas exchanges related to increased blood flow. Option B. Fluid volume excess related to peripheral vascular disease. Option C. Risk for injury related to edema. Option D. Altered peripheral tissue perfusion related to venous congestion. Right answer is Option D. Altered peripheral tissue perfusion related to venous congestion. Altered peripheral tissue perfusion related to venous congestion takes highest priority because venous inflammation and clot formation impede blood flow in a patient with deep vein thrombosis. Is incorrect because impaired gas exchange is related to decreased, not increased, blood flow. Is inappropriate because no evidence suggests that this patient has a fluid volume excess, may be warranted but is secondary to altered tissue perfusion. When positioned properly, the tip of a central venous catheter should lie in the Option A. Superior vena cava. Option B. Basilica vein. Option C. Jugular vein. Option D. Subclavian vein. Right answer is Option A. Superior vena cava. When the central venous catheter is positioned correctly, its tip lies in the superior vena cava, inferior vena cava, or the right atrium, that is, in central venous circulation. Blood flows unimpeded around the tip, allowing the rapid infusion of large amounts of fluid directly into circulation. The basilica, jugular, and subclavian veins are common insertion sites for central venous catheters. Nurse Nikki is revising a client's care plan. During which step of the nursing process does such revision take place? Option A. Assessment. Option B. Planning. Option C. Implementation. Option D. Evaluation. Right answer is Option D. Evaluation. During the evaluation step of the nursing process, the nurse determines whether the goals established in the care plan have been achieved, and evaluates the success of the plan. If a goal is unmet or partially met, the nurse re-examines the data and revises the plan. Assessment involves data collection. Planning involves setting priorities, establishing goals, and selecting appropriate interventions. A 65-year-old female who has diabetes mellitus and has sustained a large laceration on her left wrist asks the nurse, "How long will it take for my scars to disappear?" Which statement would be the nurse's best response? Option A. The contraction phase of wound healing can take 2 to 3 years. Option B. Wound healing is very individual but within 4 months the scar should fade. Option C. With your history and the type of location of the injury, it's hard to say. Option D. If you don't develop an infection, the wound should heal any time between 1 and 3 years from now. Right answer is Option C. With your history and the type of location of the injury, it's hard to say. Wound healing in a client with diabetes will be delayed. Providing the client with a time frame could give the client false information. One aspect of implementation related to drug therapy is Option A. Developing a content outline. Option B. Documenting drugs given. Option C. Establishing outcome criteria. Option D. Setting realistic client goals. Right answer is option B. Documenting drugs given. Although documentation isn't a step in the nursing process, the nurse is legally required to document activities related to drug therapy, including the time of administration, the quantity, and the client's reaction. Developing a content outline, establishing outcome criteria, and setting realistic client goals are part of planning rather than implementation. A female client is readmitted to the facility with a warm, tender, reddened area on her right calf. Which contributing factor would the nurse recognize as most important? Option A. A history of increased aspirin use. Option B. Recent pelvic surgery. Option C. An active daily walking program. Option D. A history of diabetes. Right answer is option B. Recent pelvic surgery. The client shows signs of deep vein thrombosis, DVT. The pelvic area is rich in blood supply, and thrombophlebitis of the deep vein is associated with pelvic surgery. Aspirin, an antiplatelet agent, and an active walking program help decrease the client's risk of DVT. In general, diabetes is a contributing factor associated with peripheral vascular disease. Which intervention should the nurse in charge try first for a client that exhibits signs of sleep disturbance? Option A. Administer sleeping medication before bedtime. Option B. Ask the client each morning to describe the quantity of sleep during the previous night. Option C. Teach the client relaxation techniques, such as guided imagery, medication, and progressive muscle relaxation. Option D. Provide the client with normal sleep aids, such as pillows, back rubs, and snacks. Right answer is option D. Provide the client with normal sleep aids, such as pillows, back rubs, and snacks. The nurse should begin with the simplest interventions, such as pillows or snacks, before interventions that require greater skill such as relaxation techniques. Sleep medication should be avoided whenever possible. At some point, the nurse should do a thorough sleep assessment, especially if common sense interventions fail. While examining a client's leg, the nurse notes an open ulceration with visible granulation tissue in the wound. Until a wound specialist can be contacted, which type of dressings is most appropriate for the nurse in charge to apply? Option A. Dry sterile dressing. Option B. Sterile petroleum gauze. Option C. Moist, sterile saline gauze. Option D. Povidone iodine soaked gauze. Right answer is option C. Moist, sterile saline gauze. Moist, sterile saline dressings support wound heal and are cost effective. Dry sterile dressings adhere to the wound and debride the tissue when removed. Petroleum supports healing but is expensive. Povidone iodine can irritate epithelial cells, so it shouldn't be left on an open wound. A male client in a behavioral health facility receives a 30-minute psychotherapy session, and provider uses a current procedure terminology, CPT, code that bills for a 50-minute session. Under the False Claims Act, such illegal behavior is known as Option A. Unbundling. Option B. Overbilling. Option C. Upcoding. Option D. Misrepresentation. Right answer is option C. Upcoding. Upcoding is the practice of using a CPT code that's reimbursed at a higher rate than the code for the service actually provided. Unbundling, overbilling, and misrepresentation aren't the terms used for this illegal practice. Thanks for watching. You can also practice this quiz on www.thestudyblog.com, link in description box. If you have any doubt, ask in comment section, and you like our video, then do like, comment, share, Subscribe our channel for regular updates.